We rely on medical professionals to deliver the highest quality of care. But the high level of harm in hospitals threatens the trust between patients and many health professionals.
We know that over 100,000 patients die in our hospitals every year from incidents that can be prevented, things like infections and medication errors. And we know we can do better. We know we can prevent these.
You go to a hospital, you put your body in other people's hands. Your life depends on the people supporting you. You have to depend on your nurses.
For more than a decade, the Betty Irene Moore Nursing Initiative has worked with every adult acute care hospital in the San Francisco Bay Area and the Sacramento region to improve the quality of care.
Healthcare is dramatically transformed. Hospitals in particular are under incredible amount of pressure to perform and to improve. No longer can somebody up in the C-suite just dictate how a hospital is going to perform. They have to engage, train, and build leaders at the front lines.
Nurses provide 95% of direct patient care in hospitals. The Betty Irene Moore Nursing Initiative engaged frontline nurses at 53 Northern California hospitals to improve patient care by addressing the biggest harms. Hospitals implemented programs to address 17 different conditions. The following are highlights from a few of these approaches. With more foundation support, UC Davis Medical Center engaged frontline nurses to implement evidence-based practice to address hospital-acquired conditions through a peer-to-peer model of coaching.
We set up our nurse champion model to be nurse experts at the bedside to support our nurses. They needed to be encouraging and motivating for our nursing staff.
When you have a nurse champion, you've got a touch point that the rest of the organization knows who to go to. You create an infrastructure that we really didn't have before for quality improvement.
With the help of the nurse champions, I've been able to really bolster my confidence in my knowledge base.
We heard other hospitals were getting patients up on ventilators, and we thought, well, that will tie in really well with preventing ventilator-associated pneumonias. It was a very big stretch. It required a lot of innovation and creativity. We reduced length of stay in intensive care units by 1.6 days by getting the patients out of bed and getting them mobilized. We have used evidence-based research and practice to improve our care. And some of this has been based on really the rigor of science and the application of that at the bedside.
Using the RN Champion model, UC Davis Medical Center reduced sepsis mortality by 40%, ICU length of stay by 1.6 days, and C. difficile by 51%. With more foundation support, all 6 Sutter Health Sacramento Sierra Region hospitals addressed sepsis and a range of harms. Frontline nurses have now moved from implementing evidence-based practices to developing their own solutions to problems. For example, nurses at Sutter noted that mortality rates for patients identified with sepsis on the floor exceeded mortality rates for sepsis patients identified in the emergency room or ICU, and worked on the solution.
We chose a nurse from each of the medical surgical units who showed some interest in the project. They were typically informal leaders who were able to mentor, educate, and influence the care of their colleagues. Once they understood the sepsis continuum, they embraced the screening process not just as a task, but as a life-saving endeavor. And they helped us design a workflow around the content for the sepsis screen, and also a workflow around how to get care to the patient's side.
Our nurses have gone from task-oriented to critical thinkers, using the skills that they have gained through our checklists, order sets, and standardized procedures to improve care.
I was given the tools to say, let's try it. I would not have been able to do that a year ago without the leadership skills and the tools that we were given. Now I feel so much more confident, and I also feel better as a clinician.
They work in partnership with other team members, and they focus overall on the best outcome for the patients. We still have our separate roles, but we're doing it together.
They were able to spread the practice until screening and early identification became the norm rather than the exception.
At Sutter Health Sacramento Sierra Region hospitals, sepsis mortality dropped by half, with over 1,500 lives saved, and Sutter's approach to treating sepsis on the floors is now being spread by the Society of Critical Care Medicine.
at Dignity Health. The Measurevention program started with a collaboration that we had with the Moore Foundation.
All 9 Dignity Health hospitals in the San Francisco Bay Area and the Sacramento region implemented Measurevention to affect patient care immediately. In real time, Dignity hospitals display data about potential harms, which enables the care team to intervene today on behalf of patients.
We're taking some of our clinicians out of care for a period of time, training them on what are the key processes of care that we know that will prevent infections, prevent someone from having a really adverse outcome. So if we can do those key things quickly, in a timely manner, the evidence tells us improves patient outcomes. Measurevention has brought a process to our bedside nurses where metrics about a patient can drive care to make a difference and save patient lives. Every day, we look to see if the evidence-based care is being delivered, and if it's not, we intervene by coaching and educating our physicians and our nurses that are taking care of the patient to change the care of that patient today. What we have found is that some of our earlier Measurevention projects have now become sustainable, that we don't need to intervene on every day, that the practice has spread and is sustainable more on its own. It's like the gift that keeps on giving.
Through Measurevention, Sequoia Hospital decreased pressure ulcers by 85% and catheter-associated urinary tract infections by 80%. In addition, the Society of Hospital Medicine places Sequoia Hospital in the top 5% of hospitals in the nation for glycemic control. In addition to working with individual hospitals, the Moore Foundation created a collaborative to accelerate the quality improvement work for the entire region.
The Beacon Collaborative involved all 38 hospitals in the San Francisco Bay Area who decided collectively to reduce harm and problems and safety issues to patients and their families in the San Francisco Bay Area. It created the footprint for the Moore Foundation to develop change and improvement at scale. So not just a single hospital, but how collectively, how the entire region could accelerate its work. Everybody wanted to learn so that they didn't have to make the mistakes that somebody else had already made. People began sharing all of their great successes and probably even more importantly, their challenges. 100% of participating hospitals throughout the Bay Area, they all got better. It was just incredible to watch that happen.
The Moore Foundation's work to improve patient care means that throughout the Bay Area and Sacramento, people have safer hospital stays. 83% of San Francisco Bay Area hospitals working in partnership with the Foundation substantially improved outcomes across 17 clinical areas. 78% reduced central line-associated bloodstream infection rates to near zero. 75% reduced sepsis mortality rates by an average of 37%, resulting in 1,000 lives saved annually. 62% reduced hospital-acquired pressure ulcer incidence by an average of 41%. And now the region has 5 magnet-designated hospitals. The Betty Irene Moore Nursing Initiative elevated the role of frontline nurses as scientists, leaders, and educators.
CEOs for healthcare everywhere are faced with a lot of challenges, changing landscape, a lot of public scrutiny around quality. The transformational piece here at UC Davis has been really the esprit de corps, that it's elevated our entire nursing staff.
It was really about building all of your nurses as leaders at the bedside. We've found that the nurses, when they understand their practice and they understand the science behind their practice, that they're much more engaged in the care and that they realize that they're going to get better outcomes.
I think that this is a model that will sustain our organization for many years to come and be a platform for us to grow off of as we move into the future of healthcare.
Participating hospitals are maintaining the quality improvement outcomes the Foundation supported, demonstrating the potential of frontline RNs to lead sustainable quality improvement efforts.